Doctors continue telling me I have plantar fasciitis after a major bruising of my heel 6 months ago. They keep telling me to stretch. Not sure at this point what to do. Hurts all the time right where I originally stepped on the dog bone. Let me know if you have any suggestions. Thanks. I do have suggestions, always. A couple of things that I want you to keep in mind. So when you have hypermobility, remember that the majority of health information you're going to get is really geared toward that middle 50%. And so there's a lot of it that doesn't quite fit you. Now, when someone has plantar fasciitis is inflammation, irritation, think red hot, of that plantar fascia where it attaches to the bottom of the heel. So we'll see how this works if I can kind of show you. So it's really right in that bottom kind of dead center of that heel, and that fascia then fans down into the bottom of your foot or where your toes are. And that fascia is designed to act as an arch, and it holds that foot in place, so that way instead of your foot being totally flat, it actually has that curve, and you need that for impact. Now, I have seen multiple people who have been misdiagnosed with plantar fasciitis. A lot of them are even self-diagnosed, where if you have foot pain, somehow you end up with that label. Be careful about that, because if that is not your issue, then trying to figure out what to do about it to change it is a lot harder. Now, I definitely see much less plantar fasciitis with hypermobility, but I do see a lot of other things. So I'm gonna go through a couple of different scenarios with you. Number one, a bone bruise. You've got a fat pad on the bottom of your heel. That's what makes it comfortable to walk on. And sometimes you get a bruise up into that, and that sucker gets sore. So a couple of things you can do. At 6 months, that should be pretty well healed. You know, we do talk about 3 to 6 months healing time, but if you're at 6 months, that should be pretty much 90% gone. So if you're still having that point tenderness, I would start trying to rub your heel and just move that heel around. Sometimes we get scar tissue from the bruising, and that starts to create pressure points. So start with that, just rubbing it all directions, trying to loosen that up. Now, if you find that, no, that's not really what it is, or if when you touch it with your hand, it feels okay, but when you walk on it, that really hurts. That gets us more into that functional piece. And this is what I see with a lot of hypermobile clients. So let's see this. So when someone is hypermobile, a lot of times we have this functional piece where the parts are there, but we end up using them wrong. And there's two scenarios I see with your case. One is that you're now walking with that toe turned out, and instead of going heel to toe over your foot, let me move this, you're actually turning your toe out and rolling over and across that center of that arch. So your foot's at this funny angle, you're rolling over and you're twisting your foot. Feet do not like to twist. It's not what they're good at. They really like to stay that forward and back movement. So take a look at that, make sure that that's not part of your issue. If it is, it tends to result in what we call a fallen arch. It's really not that your arch has fallen, hasn't gone anywhere. You're just twisting it to where it's starting to hit the ground. If that's your case, straighten your toes out, squeeze your butt, make sure that you're going straight forward over your foot. Now, the second thing that happens is this was 6 months ago, and I'm sure it was really painful. So when you have something like that, you tend to avoid putting pressure on that spot, even if it was like a bruise. So if you're avoiding that spot, we tend to try and shift. So either we're putting weight on the outside of our foot, or we're starting to curl our toes and use our toes kind of like monkey toes, where you're really trying to like grip and suction cup the ground to hold yourself up. And those are small muscles. They get tired fast. They really don't like that. So if that's the case, you're gonna still find that you're getting foot pain on the bottom of your foot, but it's from this overuse issue. And if you're doing that, what I recommend is relax your foot. You know, quit gripping with your toes, start to kind of watch that. And instead of thinking about trying to really use your foot, start thinking about trying to use your hips more. So relaxing your feet, almost treating them like they're blocks of wood, and think about moving from your hips so you're getting those bigger muscles working, and that is really helpful. Now back to the question about stretches. So in a normal foot, we have that fascia that's on the bottom, and then your calf muscle, I can kind of show you here. So your fascia is down here, and that calf muscle attaches to the other side of that heel bone in the back. And so for a lot of people, if their calf is too tight, it pulls on that heel bone and puts extra pull and pressure on that fascia on the bottom. So you stretch out your calf, and then that feels better. Now with hypermobility, sometimes we get extra muscle spasm and tightness because those muscles are working so hard to try and stabilize our ankles. And so it can appear like we have tightness even though we don't. So a little test to see if your calves are in fact actually tight. You're gonna use a wall, and you're gonna put your foot, your toes, get a point, about 10 centimeters away from the wall, about 4 to 5 inches. And with your heel down on the ground, you're gonna try and bend your knee forward and see if you can touch the wall without lifting your heel. So if you can do that, your muscle length is fine. You don't need to be stretching. If you can hardly move, then okay, you've got some calf tightness too, and you can start working on that as well. My guess is you've probably been doing some stretching, it's probably done nothing, and that's not as much your issue.